Stool stuck in the rectum is more than just an uncomfortable inconvenience. It can be a warning, sign that your digestive system needs attention. Understanding the causes, recognizing the symptoms early, and taking appropriate action can prevent serious complications and improve your overall well-being. Remember, persistent constipation should never be ignored, especially when accompanied by rectal pressure, pain, or difficulty passing stool. By staying hydrated, eating enough fiber, remaining physically active, and seeking medical help when needed, you can protect your digestive health and avoid the discomfort and risks associated with stool impaction. Your body often gives warning signs before a major problem develops. The key is learning to recognize them and act before it's too late. Have you ever felt the urge to have a bowel movement, but nothing happens, no matter how long you sit on the toilet or how hard you try? It can feel frustrating, uncomfortable, and even frightening. Many people assume this is just ordinary constipation and expect it to go away on its own. However, in some cases, the problem is much more serious. A large, hardened mass of stool can become trapped in the rectum, making it extremely difficult or even impossible to pass naturally. This condition, known as fecal impaction, affects thousands of people every year and often develops gradually without obvious warning signs. What makes this issue particularly concerning is that many individuals feel embarrassed discussing bowel problems, causing them to delay seeking help until symptoms become severe. As a result, a condition that might have been relatively easy to address in its early stages can become much more complicated and painful. You may experience a constant feeling of fullness, pressure in the lower abdomen, bloating, discomfort while sitting, or the sensation that your bowels are never completely empty. Some people even notice unexpected symptoms such as nausea, loss of appetite, or leakage of liquid stool, which can be confusing because it may seem like diarrhea when the real problem is actually a blockage. Understanding what is happening inside your body is essential because the signs of stool impaction are often mistaken for other digestive issues. The longer the stool remains trapped, the harder and drier it can become, increasing the difficulty of passing it naturally. Throughout this discussion, you will learn why stool becomes stuck in the rectum, who is most at risk, how to recognize the warning signs before complications develop, and what practical steps can help restore healthy bowel function. You will also discover why certain common habits may unknowingly increase your risk of this condition, and what simple lifestyle changes can make a significant difference in preventing it from occurring in the future. Stool impaction does not happen overnight. In most cases, it begins with ordinary constipation that gradually becomes more severe over days, weeks, or even months. To understand why stool gets stuck in the rectum, it is important to know how the digestive system normally works. After food is digested, waste material moves through the large intestine, where water is absorbed. The remaining waste then forms stool and is eventually passed out of the body through the rectum. When stool stays in the colon for too long, the body continues absorbing water from it. As a result, the stool becomes harder, drier, and much more difficult to pass. Over time, this hardened stool can accumulate and form a large mass that becomes lodged in the rectum, creating a blockage known as fecal impaction. One of the most common causes of this condition is a low-fiber diet. Fiber adds bulk and softness to stool, helping it move smoothly through the digestive tract. People who eat large amounts of processed foods and very few fruits, vegetables, or whole grains are more likely to experience constipation. Dehydration is another major factor. Without enough water, stool becomes dry and compact, making bowel movements more difficult. A lack of physical activity can also slow down intestinal movement, increasing the likelihood of constipation and stool buildup. Certain medications may contribute as well, including some pain relievers, antidepressants, antacids containing calcium or aluminum, and iron supplements. Ignoring the urge to have a bowel movement is another common but overlooked cause. When people repeatedly delay going to the bathroom, stool remains in the colon longer and becomes harder over time. Older adults are especially vulnerable because digestive function naturally slows with age, and many may have reduced mobility or take medications that affect bowel movements. Understanding these causes is crucial because preventing stool impaction often starts with addressing the habits and conditions that allow constipation to develop in the first place. One of the most important things about stool impaction is recognizing the warning signs before the condition becomes severe. Unfortunately, many people ignore the early symptoms or mistake them for ordinary constipation, allowing the problem to worsen over time. When stool becomes trapped in the rectum, The body often sends clear signals that something is wrong. One of the earliest signs is a persistent feeling that you need to have a bowel movement but cannot successfully pass stool. You may spend a long time on the toilet, strain repeatedly, and still feel as though your bowels are not completely empty. This sensation can become increasingly frustrating and uncomfortable. As the impacted stool remains in place, pressure begins to build within the rectum and lower abdomen. Many people experience bloating, abdominal fullness, and cramping. Some describe it as feeling like there is a blockage preventing anything from moving normally. Sitting may become uncomfortable because of the pressure in the rectal area. In some cases, pain develops during attempts to pass stool, especially if the hardened mass stretches the surrounding tissues. One symptom that surprises many people is the appearance of watery stool or leakage. Because liquid waste can sometimes flow around the impacted stool, a person may believe they have diarrhea when the real issue is a severe blockage. This can be misleading and may delay proper treatment. Other warning signs include nausea, reduced appetite, fatigue, and a general feeling of discomfort. As the condition progresses, some individuals may even experience headaches, irritability, or difficulty concentrating due to ongoing discomfort. In more serious cases, symptoms can become severe enough to interfere with daily activities. Persistent rectal pain, significant abdominal swelling, vomiting, or an inability to pass either stool or gas should never be ignored. These symptoms may indicate a more advanced blockage that requires prompt medical attention. Recognizing these warning signs early can help prevent complications and allow treatment to begin before the condition becomes more difficult and painful to manage. If you believe stool is stuck in the rectum, it is important to respond calmly and take the right steps rather than immediately resorting to excessive straining. Many people assume that pushing harder will solve the problem, but in reality, forceful straining can make the situation worse. It can increase pressure on the rectum and anus, leading to hemorrhoids, anal fissures, bleeding, and significant discomfort. The first goal should be to make the stool softer and easier to pass, while encouraging the natural movement of the bowels. One of the simplest and most effective measures is increasing fluid intake. Drinking adequate water helps soften stool and supports healthy bowel function. If dehydration has contributed to the problem, restoring proper hydration may improve symptoms. Gentle physical activity can also be beneficial. Even a short walk can stimulate intestinal contractions and encourage movement within the bowel, digestive tract. Remaining active is often more helpful than lying down or remaining seated for long periods. Some people may benefit from stool softeners, osmotic laxatives, suppositories, or enemas. These treatments work in different ways to soften stool or stimulate bowel movements. However, they should be used carefully and according to medical recommendations, especially for older adults or individuals with chronic health conditions. Overusing laxatives can sometimes create additional problems and may not address the underlying cause of the impaction. It is also important to pay attention to warning signs that indicate professional medical care is needed. Severe abdominal pain, rectal bleeding, vomiting, fever, significant abdominal swelling, or a complete inability to pass stool or gas should never be ignored. These symptoms may suggest a more serious obstruction or complication that requires immediate evaluation. Healthcare professionals have safe and effective methods for removing impacted stool when home remedies are unsuccessful. Seeking help early can often prevent unnecessary pain and reduce the risk of complications. The sooner appropriate action is taken, the easier and safer it is to restore normal bowel function and relieve the discomfort caused by stool impaction. Many people assume that constipation is simply an inconvenience that will eventually resolve on its own. But when stool becomes impacted and remains stuck in the rectum, ignoring the problem can lead to serious complications. What starts as a small digestive issue can gradually develop into a condition that affects overall health and quality of life. The longer the stool stays trapped, the harder and larger it can become, increasing pressure within the rectum and lower intestine. This pressure can cause significant discomfort and damage to the surrounding tissues. One of the most common complications is the development of hemorrhoids. Constant straining during bowel movements places extra stress on the veins around the anus, causing them to swell and become painful. In addition, hard stool can create small tears in the lining of the anus, known as anal fissures. These tears may cause sharp pain during bowel movements and can sometimes lead to bleeding. The discomfort associated with these conditions often makes people avoid using the bathroom, which can further worsen constipation and create a difficult cycle to break. As stool impaction progresses, The pressure inside the bowel may increase to the point where normal movement of waste becomes severely restricted. This can result in a bowel obstruction, a potentially serious condition that may cause severe abdominal pain, bloating, nausea, vomiting, and the inability to pass stool or gas. In some cases, prolonged pressure can reduce blood flow to nearby tissues, increasing the risk of inflammation, ulcer formation, or tissue damage. Older adults and individuals with chronic illnesses may be particularly vulnerable to complications because their bodies often have a reduced ability to recover from prolonged bowel problems. Severe impaction can also affect appetite, energy levels, and daily functioning, making routine activities difficult. What makes these complications especially concerning is that many are preventable when the symptoms are recognized early and treated appropriately. Taking persistent constipation seriously and seeking timely medical attention can help avoid these risks and protect long-term digestive health. Preventing stool impaction is far easier, safer, and more comfortable than treating it after it has already developed. The good news is that most cases can be significantly reduced through simple daily habits that support healthy digestion and regular bowel movements. Prevention begins with understanding that the digestive system functions best when it receives the right combination of fiber, fluids, physical activity, and consistent bathroom habits. Small lifestyle changes may seem insignificant at first, but over time they can have a powerful impact on bowel health. One of the most important preventive measures is eating enough dietary fiber. Fiber helps add bulk and softness to stool, making it easier to move through the intestines and pass naturally. Fruits, vegetables, legumes, nuts, seeds, and whole grains are excellent sources of fiber that support regular bowel function. Increasing fiber intake gradually is often recommended because sudden large increases may cause bloating or gas in some individuals. Hydration is equally important. Water helps keep stool soft and prevents it from becoming dry and difficult to pass. Many people do not realize that mild dehydration can contribute to constipation. Drinking sufficient fluids throughout the day supports normal digestive processes and reduces the likelihood of stool hardening within the colon. Physical activity also plays a major role. Regular movement stimulates the muscles of the digestive tract, helping waste move efficiently through the intestines. Even simple activities such as walking can improve bowel regularity. Another key habit is responding promptly when the urge to have a bowel movement occurs. Ignoring this signal repeatedly allows stool to remain in the colon longer, where additional water is absorbed, making it harder and more difficult to pass. Establishing a consistent bathroom routine may also help train the body to empty the bowels more regularly. People who take medications known to cause constipation should discuss preventive strategies with their healthcare provider. Monitoring bowel habits and addressing constipation early can prevent more serious problems from developing. By maintaining these healthy daily practices, you can greatly reduce the risk of stool impaction and support long-term digestive comfort, regularity, and overall well-being. Here is the final conclusion for your speech. As we come to the end of today's discussion, remember that stool stuck in the rectum is not just an uncomfortable problem, it is a warning, sign that your digestive system may need attention. Many people ignore constipation, hoping it will resolve on its own, but when stool becomes impacted, it can lead to pain, hemorrhoids, anal fissures, bowel obstruction, and other serious complications. The good news is that most cases can be prevented through simple daily habits such as eating enough fiber, drinking plenty of water, staying physically active, and responding promptly to the urge to have a bowel movement. The most important takeaway is to listen to your body. Persistent constipation, rectal pressure, difficulty passing stool, abdominal bloating, or the feeling of incomplete emptying should never be ignored. Early action can often prevent a minor problem from turning into a major health concern. If symptoms become severe or do not improve with basic measures, seeking medical attention is the safest and smartest choice. Your digestive system works hard for you every single day, and taking care of it is an investment in your overall health and well-being. Small changes in your daily routine can make a remarkable difference in keeping your bowels healthy and functioning properly. By recognizing the warning signs, understanding the causes, and taking preventive steps, you can reduce your risk of stool impaction and enjoy better digestive health for years to come. Thank you for watching, and remember, when it comes to your health, paying attention to the early signals your body sends can make all the difference.